Hello and welcome to The Explainer. Today, we're diving into something that's on a lot of new mothers' minds, how to handle the pain after a C-section. But we're going beyond the basics to tackle some really dangerous myths that could actually put you at risk. Let's get right into it.
Look, if you're scheduled for a C-section or you're already recovering from one, it is completely normal to worry about the pain. I mean, it's major surgery, right? So how do doctors actually manage that pain? What's the real story?
You've probably heard about it. Maybe friends have talked about a pain balloon or a PCA device being the ultimate solution. But here's the thing that's genuinely concerning. There's a ton of misinformation floating around about these devices. And these myths aren't just wrong. They can be incredibly harmful. So, let's start by figuring out what this thing actually is.
All right, so what exactly is this magic pain balloon that people keep talking about? Let's break down what a PCA is and, how it really works.
Okay, so PCA stands for Patient-Controlled Analgesia. And the name really says it all. It puts a little bit of the control back in your hands. It's basically a small, portable pump that gives you a customized dose of pain medicine right when you need it.
When you look at how it's built, it's actually pretty straightforward. First, you've got the pump, which is often a little balloon full of medicine inside a hard plastic shell. A tube carries that medicine out of the pump. That tube connects to a control button, which is what you press to give yourself an extra, preset dose if you feel a wave of pain. And finally, the whole thing connects right into your IV line, your cannula. Simple, right?
To make it all sound a little less intimidating, Dr. Mohammed Ismail, whose insights are guiding this explainer, has this really great way of describing it. He tells his patients to think of it like they're a superhero, that you wear it like Captain Zizo. He calls it the outfit for after the birth. And that's just a brilliant way to frame it, because the whole point is to make pain management easier, more mobile, and way less scary.
Okay, so we know what it is, but now we absolutely have to talk about what it isn't. And honestly, this is the most important part of our whole conversation today. The 3 most dangerous mistakes people are making when it comes to PCAs.
The first mistake, and probably the most common one, is thinking that a PCA is just a PCA, that it's a generic plastic device and that they're all interchangeable. This could not be more wrong, and honestly, this one misunderstanding is the source of all the other problems.
Here is what you have to understand. The plastic pump is just the container. The real magic, the real medicine, is the specific cocktail of drugs inside it. And that cocktail is mixed by your anesthesiologist just for you. They're looking at everything, your weight to get the dosage just right, and your entire medical history. Like, do you have asthma? If you do, they'll make sure to leave out certain drugs that could actually be dangerous for you. So what works perfectly for your friend could be totally useless or even harmful for you.
And that brings us to the single, most dangerous, critical myth that we need to bust right now. It's this idea that you can borrow a PCA from a friend who didn't use all of hers, or that you can pass yours along to someone else. Let me be perfectly clear. This is an absolute 100% unequivocal no.
And here's exactly why. Dr. Ismail puts it so bluntly, but it's the truth. The PCH tube connects to the cannula that's in your vein. It connects directly to your bloodstream. You would never, ever share a needle with someone or just give your blood away outside of a proper medical procedure, right? Well, this is absolutely no different. This device is for one person, one time. After that, it's considered medical waste and it gets thrown away. Period.
So let's just make this crystal clear. Do not share it, do not reuse a leftover one, and you definitely can't just sterilize it yourself and pass it on. You must only use the one that was specifically prescribed and prepared for you. And when it's done, it has to be disposed of properly. There are absolutely no exceptions to this. None.
The third big mistake comes from this mindset that when it comes to pain relief, more must be better. Some people think, okay, I'll get the PCA and a tap block and other pain meds, just piling everything on top of each other to be safe. But that is not how good, effective pain management works at all.
So, what is your medical team actually trying to do? Their goal is to give you appropriate, customized care. For the vast, vast majority of patients, a PCA that's been properly customized for them is more than enough to handle the pain after a C-section. The goal isn't to just throw every treatment in the book at you, is to find the right treatment that fits your specific situation. You have to trust your medical team to make that call.
All of this really points to a huge fundamental shift in how we need to think about a PCA. It's not a product, it's not a gadget, it's a prescription.
And this, right here, is the most important thing to remember. A PCA is not an off-the-shelf item you can just buy or borrow from someone. Think of it as a liquid prescription, one that's carefully formulated in the hospital pharmacy by a specialist, just for you. The plastic device? That's just the bottle.
I mean, just think about the professional process that happens behind the scenes. It always starts with your anesthesiologist taking a really detailed medical history. Then, they figure out the exact right combination of drugs for you. After that, they calculate the precise dosages based on your body. And only then do they prepare the PCA. It is a completely personalized medical treatment from start to finish.
So after clearing up all this misinformation, everything we've talked about really comes down to one final important question. And this one is for you to answer.
Now that you know the truth, that a PCA is a personalized prescription, not some generic product, and you understand the very real, very serious risks of misusing one, are you ready to have an informed, confident conversation with your doctor about your pain management plan? Because ultimately, that is the real key to a safe, comfortable recovery. Thanks for watching The Explainer.